I'm going to be going over the operation procedures for the Cpap. This is for patients over 12 years of age with pneumonia, pulmonary edema, COPD, CHF, and asthma, and near drowning, who can cooperate and have spontaneous respirations. Any patient in respiratory distress with signs and symptoms consistent with asthma, CHF, or COPD, pneumonia or pulmonary edema, or experience near drowning, and exhibit 2 or more of the following problems: a pulse ox less than 90%, respiratory rate above 25 times a minute, retractions, use of accessory muscles, or rails. Your counterindications for this is a GCS score below 9, systolic blood pressure below 90, inability to maintain their own airway. That's a key point. Respiratory or cardiac arrest, major trauma, especially in the face, or if they have ICP, intracranial pressure, significant chest trauma, vomiting, pneumothorax, gastric distension, or severe facial injuries. There's many ways of using this in conjunction with your patient, but the most important is to make sure your patient understands why you're using this and what it's going to do for them. The biggest part is making sure that you keep your patient calm and understand what you're doing. You have to make sure that they understand. Patients will not tolerate this well if they've never been on Cpap. Now I'm going to go over the use of the Cpap, how to use it. It comes with a mesh hat. The mesh hat has a tag on the back. You'll see the white tag. That goes to the back part of the patient's head. You place it over top the patient's head. This is the first item that you want to use out of this bag. Make sure it's secure in the back of the patient's head. It has Velcro straps on each side. There's 4 of them. Then it comes with a mask and a tubing. As you can see, in the mask and the tubing, there's a white seal right here that goes inside of the mask, not the other side. It won't fit and it won't work if you do it the other way. Turn this on first. The liters are 15 to 25 liters per minute for this. 15 liters is for your asthma, COPD, pneumonia, pulmonary edema, or victims of near drowning. You can turn this up till they can tolerate it better, or you get better lung expansion or more oxygen to the body. Make sure you watch your SpO2 while you're doing this. Watch it rise. If they're anxious, show them that it's rising. Show them that their oxygen level in their body is getting better. They'll seem to calm down for that with the patients I've had. Your CHF patients will go clear up to 20 liters, or I've used flush on your flow on your gauge. Watch your oxygen level in your squad or your tanks, because this will drain it quickly. After you turn this on to whatever liters you want, make sure you have the oxygen running first before you place this on the patient's face. Let them feel the air before you place it. Place it over the bridge of the nose, under the chin. Make sure you don't have any leakage. Sometimes it takes 2 people to do this. Place it on there firmly and hold it. If they start getting anxious, explain to them, reassure them that this is what's going to bring up their oxygen. You'll have small little holes in the straps here that'll go over the blue ring around this that has little clips on it. You put all 4 on there. That's where it becomes a little difficult, because you've got to tighten these up. Making sure, once again, that you still have your oxygen running. You don't want to turn the oxygen off at all, because 1, this will make them start building up and dropping their oxygen level. And 2, you want to make sure that this is firm. You pull the Velcro. Sometimes the straps will come off. You can put your finger over top of it. That's one way I handle it. And tighten it up. You do each strap by holding. Usually 2 people will help you out. If you have 2 people doing this, help you better. Until this is completely firm and tight on the face. Make sure there's no leakage around the nose, the chin, the side of the cheeks. If it does, it'll make a sound like you're blowing on somebody's belly. because it'll make the cheeks go. I hate to make a sound for you, but that's the best way I can explain it. Once it's on there and it's firm, this will force air into the lungs, help the patient bring in more air. It'll help push down fluids. If they're in their lungs, it'll help them breathe better. Your oxygen levels will rise kind of quickly in the patients that tolerate it. If they don't tolerate it well, follow your protocol for the anxious patient.